as requested on today's episode of Make It Make Sense Cardiology Edition, I give you coronary artery calcium scoring. This is an absolutely excellent diagnostic imaging tool that is used to assess the amount of calcium buildup within the coronary arteries. It also can be used to try to help diagnose, well, of course, it'll help diagnose coronary artery disease without question, but it can also be used to help with risk factor or risk factor stratification for those patients who do not have any documented evidence of coronary artery disease, but may have some family history of CAD and may have come to their respective cardiology provider with certain questionable symptoms. The calcium scoring is done by CAT scan imaging, and it is a non-invasive test. Non-invasive, that means we are not puncturing the skin in any kind of way. It is a non-invasive test to, again, look at the amount of calcium burden or deposits that are in the coronary arteries. Now, there are 4 coronary arteries that are being assessed. And I know automatically some people are thinking, okay, you got the LAD, you got the RCA, you've got the circumflex. What's the 4th one? The 4th one is your left main artery. Remember, the left main is the giant trunk that is at the top of the heart, from which 2 of your native arteries that bring blood flow into the heart originate. From the left main artery, which branches off of the left side of the aorta, you've got the LAD, which is your left anterior descending artery that feeds blood flow to the left side front portion of the heart. And then you also have your circumflex artery, which comes, it feeds blood flow to the left side back portion of the heart. Off of the right side of the aorta, you have your RCA, which is your right coronary artery, and that brings blood flow to the right side of the heart. So the calcium scoring, CAT scan for the calcium scoring, looks at your left main, LAD, circumflex, RCA, okay? The scoring that is calculated, well, before we get into that, to prepare for the coronary artery calcium scoring, your provider is going to prescribe you 2 medications if you don't already have them in your medication arsenal. The first medication is going to be a beta blocker, a cardioselective beta blocker, okay? Because we want the heart rate to be at or below 65 to 70 beats per minute. You don't want the heart racing or beating too fast that the images from the CAT scan can't capture, good pictures. So you got to make sure that the heart rate, it doesn't have to be in the basement, not at all, but the heart rate can't be like 90, 100 beats per minute. That's way too much motion and activity for the CAT scan to get good, clear pictures. Make sense? So your cardiology provider is going to prescribe you a tablet of metoprolol or atenolol, maybe even bisoprolol, but a cardioselective beta blocker that will be given 1 hour before your CAT scan to slow the heart rate down to no more than 65 to 70 beats per minute, so we get good, clear pictures. That's medication number 1. Medication number 2, sublingual nitroglycerin. Just as you want the heart rate to be, nice and steady and on the lower side, you also want the vessels, the blood vessels of the heart, to be as open as possible so that, again, you get good, clear pictures. The nitroglycerin doesn't last in circulation very long, so an hour before you will get that beta blocker, and then right as the technician is ready to take your images, they'll have you pop the nitroglycerin under the tongue, and then the pictures from the CAT scan will be taken. The test in its entirety will probably last anywhere between 30-35 minutes on or about, okay? Once the images are taken, then of course the interpreting radiologist has to do their part. There is a specific calculation method that is used to obtain the score of the calcium scoring test. And this is not anything that you have to calculate as a nurse or even as a layperson. You don't do that part. There's an internal algorithm that the machinery used to take the images will calculate, okay? So you don't have to worry about that part. Best case scenario when you get this calcium scoring done, best case scenario is that you have a 0 score. No calcium deposits discovered. Beautiful. No calcium score or 0 calcium score means no coronary artery disease. Lovely. There is not, as of yet, there is not any discrete information or research that shows what the highest possible calcium score can be, because there are a lot of factors that go into the calculation of that score, lots of variables. So there is no maximum amount of a calcium score that you can get. What you should be aware of is that a calcium score in either one of the arteries or a total calcium score of 400 or so is usually indicative of a moderate calcium burden, moderate plaque burden. And what your ordering cardiology provider chooses to do with that information, that's going to be a conversation that you have together, because again, you have to factor in the reasons why the test was ordered to begin with. Were you symptomatic? Are you just looking to see where your heart stands because, you know, you may have had parents that had a heart attack or siblings with a heart attack or, you know, some sort of cardiac problems? Your results, the interpretation of your results, the plan of action as a result of your testing, that is a conversation to be had with you and your respective cardiologist so that an individual plan of care can be created for you. That's it and that's all. That is a coronary artery calcium score in a nutshell. Hope this was informative. If this was helpful information for you, like, follow, post, share, all that jazz. For the record, I'm out running errands today, but I am really clearing out my calendar to make time for a go live. I promise you, I am making time for it. Just because I'm not at work today in the formal sense does not mean that I have no work to do on the weekends. Oh Lord, there's a lot of work that I do on the weekends, including now making these posts. But there's a YouTube channel that is in the works so that you guys can have more elongated lecture sessions on all of the topics that I have created or done posts on so far. I am working on a written study guide for everything that I have posted about so far. Like there's work being done, okay? So just give me a little grace if you would, please. But big things are coming. Big things are coming. Later, taters.